The next question, how often do I need to be seen? So this is one of my favorite questions because it totally depends. So in psychiatry, it's all contextual and dependent anyway, right? So if you come in, I like to give the example that if you go to a doctor and you ask her, like a family practice doctor, and you ask her, hey, I have a cough, what's wrong with me? She's going to ask you like 18 million questions because a cough can be 18 different things. And so, in the world of how psychiatry is practiced, it is very variable, very variable. And so, for example, even within our own practice, so even within mindful, it's incredibly variable. So, one of our doctors, she is board certified in integrative medicine, and so she actually takes 2 hours for every new patient appointment to really get to know you, to spend some time delving into your medication history, your food history, stressors, all sorts of things, because she wants to make sure that all facets of you are accounted for. And it's a 2 hour first appointment. For me, I do a 90-minute appointment. The way that I was trained, I went to the University of Kentucky, go Cats. And I do a 90-minute appointment for kids because it takes that long for me to talk to the kiddo or talk about the kiddo, depending on the age, and then talk with the parents and do a lot of behavioral training. And so I'm a big fan of behavioral coaching and parent coaching and that sort of thing. And so I infuse a lot of that in my first appointment. For my new adult patients, I do 60 minutes, and most of the other doctors do as well. But your practice, the person that you see may do 45 minutes. That's actually pretty common. So 45 minutes for a new adult patient appointment. And then follow-up appointments, again, it totally depends on where you are. So for a lot of folks who are in the community mental health system, because they have to see so many people, you see how that goes. See so many people in an hour. Sometimes they'll do 15-minute appointments, 20-minute appointments. Really established psychiatrists who've been doing this a really long time, who have seen everything, and they sometimes will do 20-minute appointments in private practice because they can almost guess what you're saying before you even say it. That's how long they've been doing it. And so those are the actual appointments themselves. And then there's a great variation of when they bring you back into the appointment, meaning if you're doing really well, for me personally, if I have an adult patient that's doing really well and they're just chilling and don't need a whole lot, I can push them out to 6 months. Some of my adult colleagues adult colleagues, meaning psychiatrists who see adults, sometimes they will even push appointments out to a year because they've been working with that person. They feel comfortable. Most times, if you as a patient or if you're looking into seeing a psychiatrist, you're going to be able to stay out of the psychiatrist's office the more work you do, and if you can verbalize what to do if there's an issue. So in other words, yes, I love the idea that all my patients are just going to knock it out the park the very first time. They're going to be like, oh, you know what, Dr. Dixon, I took my medicine and I feel great. But that didn't always happen. And so I want to make sure that all of my patients have a safety plan, a backup plan in case something goes amiss or awry. And so if you can verbalize that to your psychiatrist, it just helps to keep you out of the office. So in general, most times you will see the psychiatrist or the whoever the clinician is, the mental health clinician. You'll see them that first time. Most times they're going to probably see you back within 2 to 4 weeks just to make sure whatever the treatment plan is working. And then depending on how you're progressing, it'll either be a month to 3 months, and then depending on how you're progressing, they'll do 3 to 6 months. And then depending on how you're progressing, they can do 6 months to a year. So it's not a linear thing, but honestly, it is, you get out what you put into it. And so if you go and see a mental health clinician and you're like, I'm not going to do anything the person said, and I'm going to halfway take my medicine, well, then you're probably going to end up seeing your clinician a whole lot, and it's going to cost you a lot of money. So it actually is in your favor to do your best to follow the treatment plan. And if you have questions about the treatment plan, ask them. That's what they're there for. So, alrighty.